The next session. So I should start by saying that I am not Dr. Richard Cho, who is supposed to be the moderator for this session, but he was not able to be here, and so I was asked by Kelly O'Brien last night to moderate this session. My name is Matt Epperson. I'm an associate professor at the University of Chicago School of Social Service Administration, and I was on the advisory committee for the planning of this Kennedy Forum. And today's topic of this breakout session is politics, money, and the courage to change. And so, generally the theme here is to think through how we engage in this struggle to obtain and deploy the proper resources for behavioral health care. In the midst of resource depletion for behavioral health, we have seen exponential increase in resources directed to the criminal justice system during the era of mass incarceration and mass supervision. The U.S. spends over $50 billion per year on incarceration. In the state of Illinois, over $1.3 billion alone. If you're not familiar with the research done by colleagues of mine here in Chicago and elsewhere called $1 Million Blocks, who happens to be familiar with $1 Million Blocks? If not, I would really encourage you to look it up. It's research that looks at blocks on which $1 million or more is spent incarcerating the folks that live on that particular block. And in a 5-year period in Chicago, there were 851 blocks on which $1 million or more was spent to incarcerate the people that lived on that block. Not surprisingly, these are not blocks where $1 million is spent on other kinds of resources, infrastructure, and pertinent to the topic today, treatment. So we're waking up more, I think many people have been awake to this, but collectively we're waking up to the long-standing reality that we are spending money on the wrong things. And we need to be spending on more humane and effective approaches rather than just criminal justice intervention and incarceration. So today's panel is focused on how we might think about shifting resources away from criminal justice system and towards better care, and the practical and political barriers that can get in the way. And so I'll briefly introduce our speakers, and you can find their full bios online. We have Cook County Board President Toni Preckwinkle. Next to her we have Harold Pollack, who is the co-director of the University of Chicago Crime Lab. And next we have Mark Levin, who is the Vice President of Criminal Justice Policy for Right on Crime. And we will have time at the end of this session to go through questions, and if you haven't done this already in another session, the way you do that is by visiting a website, and I will give you the address slowly right now. It's KF, as in Frank, .cn, as in Nancy, F.io. I'll say it one more time. kf.cnf.io. If you go into that website, you'll see all the panels listed, and you can click on this panel, which is called Politics, Money, and the Courage to Change. You can submit a question. If you don't want to submit a question but look at the questions submitted, you can do that and sort of like or vote on the ones you like, and that will make them rise to the top. And then we'll spend the last few minutes covering those questions. All right, so each of you do different kinds of work in this area of thinking of how we can better resource more effective approaches to the issues of people with behavioral health challenges ending up in the criminal justice system. So maybe if we could just start with a couple minutes, each of you sort of hit on what you think are some of the most relevant pieces of your work that speak to this issue.
Good afternoon. One more time. Good afternoon.
Good afternoon.
So I'm a teacher. May astonish you to know that. First of all, I want to thank all the people who came up front. Believe me, when you're on a panel like this, it's much easier to relate to your audience when everybody's kind of close to you instead of spread all over the room. So thank you for being responsive. I appreciate it. 90% of Cook County's money is spent in two arenas: public health, 50%, public safety, 40%. 90% of our resources are spent on public health and public safety. And surely the struggles we have around incarceration and detention and putting people in jail who are substance abusers or who struggle with addiction kind of come together in Cook County. Because surely people who don't get the mental health services they need end up either in our criminal justice system or in crisis in our hospital system, in our healthcare system. I want to acknowledge the presence of Amy Campanelli. Amy, you want to stand up, please? Amy is our public defender. I want to thank her for her good work. So I'm just going to relay a couple of quick facts about Cook County. Well, first, let's start with the country. You all are aware, of course, that the United States has 5% of the world's population and 25% of the world's people in jail or prison. 25%. And I usually say, unless you think Americans are more inclined to be criminals than people elsewhere in the world, we're doing something terribly wrong. We're doing something terribly wrong. In Cook County, half of the population is African American and Latino. 86% of the people in our jail are African American and Latino. So what happens in this country, if you look at detention and incarceration rates, for white people, they're about the same as Northern Europe. We have so many people in jail or prison because we're incarcerating and detaining our black and brown people at just astronomical rates. And that's a function of the profound racism in this country that we continue to refuse to deal with and deny. And it gets played out in the criminal justice system in the most brutal and terrifying ways. When I was elected in 2010, I made criminal justice reform a hallmark of my administration. I asked all the actors in criminal justice, the chief judge, the state's attorney, the public defender, the sheriff, and the clerk of the court to come together and talk about what we needed to do better and how we were going to measure our progress. And everyone agreed that we had too many people accused of nonviolent crimes in our jail, and that we ought to try to work together to do something about that. Now, many of the people accused of nonviolent crimes struggle with mental health issues and substance abuse. They're in jail because of their shoplifting or their use of illicit drugs or their prostitution. And so we focused on people accused of nonviolent crimes. And for the first couple of years, we didn't make much progress. We still had about 10,000 people in the jail. And then, where's Justice Burke? I thought she was going to join us. Justice Ann Burke chairs our Justice Advisory Council for the county. She's a member of the Supreme Court. And we asked the Supreme Court for help in 2013. So in 2010, everyone committed to trying to do something about the high rates of detention in our jail. And it wasn't until we got some help from the Supreme Court in 2013, bringing all the actors together, using a hammer that I didn't have, that we began to make some progress. And so we've gone from 10,000 people in the jail to fewer than 6,000. And that's mostly because we have removed from the jail those people who are awaiting trial for nonviolent crimes. They now await their trial, their hearings and their trial out in the community rather than behind bars. And we've done that by focusing on bond court, because bond court is the port of entry into our criminal justice system. And the chief judge has asked his judges in bond court to very strictly observe the rule, which is supposed to be that detention is the last resort. That people are not supposed to get cash bonds that they can't pay for relatively minor offenses, alleged offenses. And as a result, the way people get treated in bond court has changed, and we've seen, instead of 1/3 of the people being released on their own recognizance and electronic monitoring and 2/3 getting cash bond, only 1/3 get cash bond now, and 2/3 are released on their own recognizance with what they call I-bonds or electronic monitoring. And it's that reversal, that flip, that has helped drive down the jail population. We hope it'll be driven down further. It's also been driven down by a cooperative relationship between the public defender and the state's attorney about who gets charged and what bail is asked. That's, I guess, what I should say. Whether or not there should be bail or whether people should be released on their own recognizance. So I'm very grateful for the actors in the criminal justice system for changing the paradigm about how people get treated in bond court and focusing more on trying to ensure that only those who are prospectively a danger to the community or themselves remain behind bars while they await the disposition of their cases, their hearings, and their trials, rather than folks who are accused of shoplifting and having a couple joints in their pocket. And it helps to have somebody champion criminal justice reform and also helps to have stakeholders all up and down the line who are really committed to criminal justice reform. And again, I want to thank the public defender. One of the things I did to try to ensure that there was more focus on these issues in the public defender's office was replace the public defender with Amy. So I am very grateful to all of the stakeholders in criminal justice for the change that we've seen here in Cook County, and I know we've got further work to do, but I'm grateful to all the actors.
Thank you. Harold?
Thanks so much. Before I start, I see there's some people in the audience that are in nonprofit organizations that I work with. I should say that I'm Harold Pollack. I co-direct the University of Chicago Crime Lab and the University of Chicago Health Lab. And we do evaluations of violence prevention and service interventions. And I am so happy to see some of our partners who actually do the work that we evaluate every day on the front lines of public health and social services.
You have to speak up. Here.
Oh,
You want me to do that
sorry.
for you?
Yeah, they're, maybe Common could give me some advice about how to do some show business basic skills. Is that better? Yes. Thank you. So I was just saying how much we appreciate the work of our partners in social services and the nonprofit sectors who are really working under very difficult conditions in Cook County Health System, Cook County Jail. My own research is mainly concerned with severely vulnerable populations that come into contact with the criminal justice system, usually because of a behavioral health or mental health issue. Sometimes there are people who are in behavioral crisis and someone calls 911. Sometimes there are people leaving the Cook County Jail who need 3 hots and a cot so that they don't end up homeless very quickly without interventions. Sometimes there are people who are arrested or detained in sting operations conducted by law enforcement and whose main problem is their drug use, not that they are violent offenders. Our core mission at the Urban Labs is really to give citizens, to give policymakers a sense of realistic evidence-based optimism about the problems that you just heard about. You know, everyone is sad about the violence in Chicago, about the high rates of incarceration in Chicago. It's a tough time in the city and in the country. Many of us don't have a sense that we can do anything about that we can do anything that's feasible. The problems are so deep that it's very easy to become very pessimistic and therefore very passive about the feasible possibilities to make a difference. And one of the things that we try to do is work with our partners in law enforcement and social services and public health to show that actually a lot of the things that we do really do make a difference. And I think that's really important. And let me mention 4 reasons why I'm optimistic about where we are right now. First, there's a real hunger for solutions across the political spectrum. In every part of government, nonprofit sector, all over the place. Our public discourse on criminal justice and mental health and addiction is surprisingly bipartisan in America in a lot of ways. It's much less disfigured by the unworthy politics that we're seeing in America right now than most other issues that we are debating. I mean, everyone has a cousin who has a problem, a child who has a problem. We all know that what we're doing is not working as a country and that we have to do better. Whether it's mental health parity or dealing with mass incarcerations, there's a real hunger to do better. And we certainly get tremendous support from government, from our nonprofit partners in trying to help. Second, we have the fundamental tool of Medicaid expansion to work with. One of the striking things, Cook County has done an amazing job of enrolling people at the jail and in other sites of vulnerability into Medicaid. In all of our interventions that we study, almost everyone we encounter has health insurance. That was not true 5 years ago in the work that we did. There are undocumented people, of course, that we encounter who are not covered, but they tend to be underachievers in a lot of the areas of violence that we're most concerned about. And we really don't see too many people that we can't somehow get insurance for. And it's remarkable, actually, all over the country that's true in a lot of states, once you get outside the Deep South. Now, I should say that Medicaid is the power line that finances so many of the things that we need to do. We don't yet know how to make it work as well as it needs to, and to make it that really effective platform. And I'm sure many people in this room could say better than I the issues with reimbursement, with the administration of Medicaid that makes it difficult, but that's the foundation that we have to work with. Third is we now have high-quality linkable data systems that we can actually use to find people, to track people, to evaluate interventions. When we have nonprofit partners who are working to help people, we can evaluate their interventions in a way that's much more powerful than they could do on their own, because we can see how many of their clients get arrested later, how many of them end up in the emergency department. And we can really start to be rigorous about this and work across systems with data. And I think that's a very promising thing. I mentioned the fourth thing, which is there's a real change in the mindset of law enforcement and the criminal justice system. The Chicago Police Department and the Cook County Jail, where we work quite closely with them, they really don't want to be locking up people who are nonviolent drug users. They actually don't want to be locking up people who are nonviolent drug sellers, who are the hired hands of the drug-selling organizations and that encounter the police department. The guy who's standing out there selling dime bags, CPD knows that if they arrest that guy, there'll be somebody else there soon enough. That's the easiest arrest you can make. And that's not what they want to be doing. We recently helped to evaluate a reverse sting operation called the West Side Narcotics Diversion Initiative, where people who were trying to buy heroin, who sort of came off of 290, were detained by undercover police. And instead of being arrested, they were deflected and given the chance to go to Thresholds, to Heartland, to Haymarket, to get the care that they needed. And we then tracked for 8 months what happened to those people. And what was amazing was, out of 39 people that we could track, and these people, I should say that they also, once these people were detained, of course, they looked to see if they were dangerous, if they had outstanding warrants and so on. The people that were eligible for the deflection, we had a total of 3 people arrested in the next 8 months. And now, the treatment helped those people, but the real issue was they just weren't criminals. They did not need to be incarcerated. There was 1 felony arrest of these people. It was a totally voluntary intervention. And law enforcement realizes that a lot of the people that are involved in drug use need help, and they don't need incarceration. So this is a difficult time for Chicago and for the country, but it's a productive time, and I just feel invigorated every day when I go to work, because all the partners that we deal with are really smart people trying to really deal with a difficult situation, but actually coming up with things that are helping. Nothing's the polio vaccine, but things that are working. So with that, I'll stop. Thanks very much.
Well, thank you, and thank you for mentioning the bipartisan appeal that this work has. At Right on Crime, we've cultivated conservative support for criminal justice reform since 2010, and more than 30 states have adopted some form of justice reinvestment, which basically takes money that would have otherwise been spent on incarceration and puts it into alternatives, treatment, problem-solving courts, prevention, and so forth. And so I'm delighted to be here in Illinois, where the leaders you mentioned, also Sheriff Dart, Kim Fox, have done incredible work. And of course, at the state level, you have adult redeploy, building on the success of juvenile redeploy. And I think the state ought to double down on that, because what that does is take some of the money that counties are saving the state by sending fewer people to prison and reinvest that into treatment approaches, better probation, and so forth. And so this is really a model that we need to pursue across the country. Now, at the front end of the system, we have to focus on giving police alternatives to bringing people to jail. And there's a number of successful models across the country on this. Where I'm from in Texas, San Antonio has pioneered diversion of people with mental illness, including their 24-hour crisis center, which gives police a place to bring someone who needs to be stabilized other than the jail. Of course, many of you are, I'm sure, familiar with the LEAD program, Law Enforcement Assisted Diversion Program in Seattle, which is now expanded to other jurisdictions. And it deals with some of the individuals selling small amounts of drugs, subsistence drug sellers, as well as drug users and people in prostitution. But these are people that it started really because a number of the folks were homeless and they were sleeping in front of businesses and so forth. And these communities in downtown Seattle were looking for a different type of policing. And the There's now been an empirical evaluation. Emergency room costs have been reduced by 2/3, jail costs by a similar amount, and recidivism as well. So what was really amazing is so many of the participants in the LEAD program, they had been arrested dozens of times, but they had never been connected to treatment or services. One of the things that we have to consider is what is the role of civil commitment, and particularly outpatient civil commitment, which avoids some of the controversies. But clearly there are people who need to be required to go to treatment. But the problem is, too often prosecutors and judges say, the only reason I'm arresting this person, and police, I have to arrest this person, I have to convict this person for trespassing to get them into mental health treatment. And that's wrong. We need a complete reversal of that approach. So one of the exciting things, you mentioned data, that can help us in making some of these alternatives effective. And there was recently an article a few weeks ago in Politico magazine about Parkland Hospital, which is one of the top 5 providers of indigent health care in the United States. But they have this IRIS data system, which basically they can track people that are homeless, people, frequent utilizers going in and out of jail, and then they can track their nutrition. They can track all of the services that are being wrapped around them. And it really is phenomenal. And so we can be doing a lot better by using these types of innovations to connect people to the services and supports that they need. And then finally, we need to look at the reentry side. And this is something we're working with the White House on now. And one of the issues we dealt with in Texas in the last legislative session was benefits. People are losing disability and other benefits when they're in jail. And what we found was sheriffs, and by the way, they get money, a kickback from the federal government for this, but they send up the names to the to Social Security Administration to have their benefits eliminated. And then when they get out of jail, they don't have that disability or other federal benefit. So we passed a bill saying they have to wait 30 days, which is the federal minimum, but they have to wait that full 30 days before sending the name up. And then secondly, the people that were in jail more than 30 days, we created a mechanism for them to restore their benefits within 48 hours by acting through the Department of State Health Services when they're discharged. So these are the types of things we need to do, and thankfully I think we have a lot of people at this event committed to it.
Great. Thanks to you all for starting to get our conversation going in this area. So I want to ask a next question that focuses on a particular kind of resource that is certainly lacking here in Chicago, and I would say, for many places in the country, which is resources around housing. So having worked in a jail myself for years prior to this career as a behavioral health provider, jails and prisons are custodial institutions. We house folks, and that's one of the largest costs, is that the actual having 24/7 facility and staffing. I also had lots of folks that I worked with who would say that the jail, unfortunately, was one of the more stable places that they were, because they got food, they had somewhat reasonable shelter, and in many ways had better living conditions than they may have had out on the street. And so if we're thinking of moving resources away from especially high-cost, low-effectiveness criminal justice interventions like incarceration towards more comprehensive behavioral health treatment, it seems to me that housing is really a critical component of that. So if you could speak to specific strategies that could help to leverage those kinds of resources, or examples of where things are going right.
Well, that's a great question, and actually I met with President Obama. This was about 9 months before he left office, but they were asking for ideas that they could do at the executive level, and one of them I gave was to roll back some of the HUD restrictions on people with a criminal record being in public housing, and they did do that. There's still some discretion for local housing authorities, but that's a major challenge. And then secondly, we passed a law in Texas, which I encourage other states to do, which says landlords can't be sued for renting to people with a criminal record. But beyond that, clearly there's a resources issue as well. And we have to acknowledge that we have this massive deinstitutionalization of people with mental illness in the 70s, and the promise was we would replace that with community-based residential programs, and that we never got around to doing that. And so there's a tremendous need for transitional housing in communities, and there may be ways through tax incentives and so forth to take some properties that are in disrepair and repurpose them for this. But undoubtedly, we can't discharge people from incarceration to go live under a bridge. We have to, whether it's through halfway houses or other, and it's a subsidy that as someone, assuming they're able to stabilize and get employment, they can start contributing and work their way off of that. But there does have to be a gradual transition for people, either coming out of incarceration or ideally as an alternative to incarceration for people that are homeless. And all the evidence has basically shown with regard to the homeless population, many of whom are also frequent utilizers of the jail, that if you get them into immediate stable housing, even if you don't get them to stop drinking, for example, immediately, that typically follows. So you want to immediately solve the housing part of it.
I would say there's 3 different housing issues that need to be discussed distinctively.
Yeah, there you go.
If I can figure out how to speak into this thing. I have a PhD from Harvard, by the way. So the first is that there's a need for supportive housing for people with intense needs. And Steve Brown at UIC and others have done some really interesting work. Some of the work around HIV gives us a good model of some supportive housing that ends up being very cost effective for people with those needs. That's one set of issues. There's a second set of issues, which is the transition issue, that people leave a jail or they leave a facility and they crash and burn at exactly the moment that they slip between our fingers in administrative systems. And critical time interventions, the supportive release center that we are helping to evaluate in the jail, that Task and Heartland are doing, is really important for those handoffs because we know that that's a significant challenge. The third thing is just general affordable housing. People with mental health and behavioral health problems are very often just poor people, or either they are poor people or the person that they need to turn to for support is a poor person. And so the general difficulty in obtaining affordable housing affects them because they're trying to couch surf, but the person that they're trying to couch surf with, they've got a housing challenge. So I think each of these 3 things requires a distinctive effort. I think that the first one where we're starting to see some really good scientific data is randomized trials involving supportive housing. And I think that is probably the first thing that I would push heavily, but these other things need attention too.
I guess I would add that while clearly we know what we need to do, we're not prepared to spend the money to do it. One of the things that challenges us in Cook County, where we do support affordable housing developments, is the declining federal support for these kinds of activities. Most of the money comes out of community development block grant money, CDBG, which is the old revenue sharing, which gives local units of government great discretion on how they can use these returning federal dollars. We spend a lot of it on housing, but the amount is either flat or declining every year, and it's been that way for more than a decade. So the federal resources that once supported affordable housing developments, and these developments are usually layered, so the federal support is combined with all kinds of other resources, is diminishing. And so while we have a great need for people who are homeless, people who are struggling with mental illness, for transitional and affordable housing, we haven't committed the federal resources that we need. And for local units of government, this is a real challenge. For the county, for example, where 90% of our money is spent on public health and public safety, and 10% is everything else we do, there aren't a lot of resources, local resources, to support affordable housing developments. And we've relied historically on these home programs, CDBG, Community Development Block Grant programs, for the support, and that support has been declining. So although this is something we know is important, it's tough to find the resources locally to do it in an environment where federal support is either stagnant or declining.
I guess I want to follow up on that. You each have sort of gave some examples where there's some either method of collaboration or some attempt to leverage resources. So I guess this is a two-part or a two-facet question that you could take one or both parts of. One, it seems like this kind of approach would mean having to make some unlikely allies. So having to reach across either political, ideological, or organizational kinds of lines in ways that aren't typically done. So if you could give some examples of that, or how you craft a compelling argument. So a lot of how we've gotten into overspending on criminal justice has just sort of been a rhetoric around public safety, right? Well, we have to put more cops on the street. We have to build more prisons to respond to public safety, without looking at the data and the logic to say, well, actually, we're building, and we're in the midst of a crime drop, for many decades. So data doesn't always solve that problem in terms of convincing folks. So if you could either talk about some kind of unlikely alliance, or maybe it's a likely alliance that you just felt was really useful, or a way to frame the argument, and I'm hearing a lot at the local level, but even at the state or federal level, that helps to sort of change some of the thinking around where we spend and how.
You know, I think this is an interesting point in time to come back to your point about hunger for solutions. You know, the people who are concerned about inequity or the racism in the criminal justice system, the bleeding heart side of the equation, have come together with the people who are concerned about fiscal responsibility. Because as I remind people, it costs $162 a day to keep somebody in jail. It's more than $50,000 a year, and I have a college-age kid, and my point is you could send your son or daughter to a very fine private school for college for $50,000 a year. And that's what we're spending to keep people in our local jails in this country. So the people who say this doesn't make sense in terms of how we're using taxpayer money, and the people who think this doesn't make sense in terms of the impact it's having on individuals and their communities, have found common ground in trying to deal with the high rates of detention and incarceration in this country. So I'm really grateful for this moment in time, to come back to your point, and to my colleagues here to my left, that from both sides of the political spectrum, the people who tend to be the sort of fiscal conservatives, and it's all about effective use of tax dollars, and the people who are concerned about the devastating impact that these rates of detention and incarceration are having on particularly black and brown communities, have come together to say we need to look at this in an entirely different way.
Well, that's right, and it's also, I think, religious communities, certainly, from a redemption standpoint, are very engaged. We work very closely with Prison Fellowship. Also, many conservatives feel strongly about we need to keep families together. This is where we're creating a generation of children of incarcerated parents who themselves are 6 times more likely to ultimately be incarcerated. One of the other interesting aspects of this issue now is many people stereotyped incarceration as an urban problem, but actually Chicago, Cook County is not alone. Incarceration has been declining in other urban areas and even slightly now in suburban areas, but it's skyrocketing in rural areas and increasing somewhat in small cities. You could go to the Bear Institute and look at their data on this. But, and this is happening alongside high rates of opioid overdose deaths, economic displacement, and other problems in rural areas. So we have a tremendous opportunity to work with. I know there's been kind of the downstate versus Chicago dynamics in Illinois, but this is a tremendous opportunity to work with people in rural areas where this problem is continuing to worsen, partly because of a lack of alternatives. I mean, y'all talked earlier about the pretrial services, the alternatives to money bail, which it's great to see that taking hold in Chicago. But in many small counties, rural counties, there is no alternative to going to a bondsman. So you just languish in jail. I was looking the other day at Wisconsin, all these rural counties, there are thousands of people in jail on $500 bail or less. This is from the Measures for Justice website. That means that they had $50, because 10% of $500 is $50. They had $50, they wouldn't be sitting in jail. And it's appalling. So that's the kind of thing we need to tackle.
I guess when I think about new kinds of alliances or unexpected alliances, I think there's a couple that come to mind. One is the way that Republican governors have embraced Medicaid around the country and are really trying to figure out, Medicaid is going to be the source of funds for a lot of the innovation in the housing area for the populations we care the most about. That's where the money is available. It's a source of federal funds that's so desperately needed. And what we're seeing is Democratic and Republican governors in the blue states and the purple states are doing a lot of really interesting, and also, interestingly enough, in the red states, in things that are below the fold in the newspaper. There's a ton of innovation happening. If it doesn't have the word ACA Medicaid expansion, but it has Medicaid in it, and nobody's going to know that it's happening, there's a lot of cross-party collaboration because people really want to solve these problems. The second is bringing the law enforcement community into the fold. The daily experience of police officers is so difficult, and the success of a lot of the things we want to do is going to really depend on what do prosecutors, what do police, what do correctional folks, what's their daily experience like? And it's important for a couple of reasons. One is they are often the street level people doing, and they decide, am I going to arrest this person or not? If I don't arrest this person, am I confident that something will happen to deal with the problem, or he'll just be back at the same street corner screaming at people again 2 hours from now? There's that dimension. There's also the dimension that the law enforcement community can speak to different parts of the society that need to be part of the consensus for progress. You know, we're a very tribalized country, and very often, in order to create constructive public policy, we have to have people, you have to have the right person that people will listen to. And so we really have to broaden that coalition, because, you know, when the law enforcement community says we need mental health resources, we need an alternative to locking these people up, people will listen to that in a different way than from me, liberal Jewish Chicago professor, says it. That's just a reality in America, and that's happening. And I think we have to really embrace that.
All right, great. Well, with the few minutes we have left, I want to make sure we get to at least a couple questions, so I'm going to do that by combining two questions from the audience. The first, and they're related, the first asks if the number of detainees has gone down from 10,000 to 6,000 in the Cook County Jail, how much money does that save and where are we spending it instead? And the sort of tandem question with that is, how do we ensure that savings from reducing incarceration are reinvested in prevention and early intervention instead of just being used to plug holes in government budgets? So I would guess that one might be aimed more towards you, President Preckwinkle, but I think we could also broaden that out to any incarceration reducing savings. How do we make sure those are spent, that money is spent on the right things?
4 or 5 years ago, we decided, as part of our criminal justice reform efforts, that we would begin funding efforts to reduce the pipelines to jail and prison. So we started grants in 3 areas: violence prevention, anti-recidivism, and restorative justice. And we've spent $5 or $6 million in the last few years on supporting community agencies that are working in these arenas. And clearly we need to spend a lot more money on that, and we hope to redirect savings in declining spending at the jail toward those kinds of grants. However, the most precipitous fall in the jail population has been over the last year or so. And so we haven't seen dramatic decreases in our expenditures in the jail. What we've started doing, however, which will lead to those decreases in the long run, is demolishing parts of the jail complex. We have a huge jail complex at 26 in California. We demolished 2 divisions last year. We'll demolish 2 more divisions this year. We're just going to keep shrinking the jail campus as a way. We've torn down the most outmoded and oldest buildings, which are the most expensive to operate. So we're going to save a lot of money in the long term on not having to invest in maintenance and operations. And hopefully we will also invest less in personnel as the jail population goes down. And let me just, I think it's important for people to understand the jail is a jail for the people who work there as well as the detainees. The attrition rate in the county as a whole is 4.5% a year. So we lose people for one reason or another. But those who work in the Department of Corrections, it's 9%. So almost 10% of the people. It's a very hard job to work in a jail. And so whatever we can do so that fewer people have to have the experience of either being in the jail or working in the jail, we ought to try to do.
Just a minute or so left, so a couple comments.
I'm going to say something that may not be popular actually in response to that. I don't think we're going to save a lot of money by reducing the jail population. And I think as in the deinstitutionalization debate, I think we have to be very wary about promising that we're going to save a lot of money by having more humane policies. We want to reduce the jail population because there's human beings who are put in a box, in an iron box, in a cage, who don't need to be there and who could be productive members of American society. The people that are not being incarcerated right now, the marginal person, is not that expensive because it's the person who really doesn't have to be incarcerated that we're getting out of the jail. The guy who's the armed robber, he's still going to be locked up. The person who's the murderer is still going to be locked up. And the marginal cost of a lot of the people that we're not incarcerating we're not going to save that much compared to the services that person's going to need out in the community. So I am very optimistic we can reduce that population. Let's not sell it as a cost-saving maneuver.
Good point.
But it is good to include a specific provision like they did in California, with realignment. And then also Oklahoma passed a ballot measure, one of the most conservative states, to reduce drug possession to a misdemeanor. But a second piece of that was reinvesting the savings into treatment. And so it is good to the extent there are savings, and I agree, at the margins, sometimes you're just avoiding future costs because you otherwise would have had to eventually replace a jail, or you might have had increased healthcare costs every year from the graying of our prison and jail populations, which is significant. So, and by the way, to the extent you have fewer people there, you can deliver better programming, we would hope. You have fewer days when the unit's on lockdown, when the day room where there's supposed to be programming is having people sleep on it, as has been the case in correctional facilities in this country. So there's a lot of other reasons to do this besides saving money, but it is good to make sure that to the extent there are savings, there are specific provisions for reinvesting those.
Great. Well, we are out of time, and so I do want to say I think we've just really started a conversation here that we all need to continue in our own respective places, whether we're at the state, local, federal level, to make that fight. And I would agree that decarceration should not be thought of as a cost savings measure, but whatever money we do save, that we invest it in the right places. So please join me in thanking our panel members.